Admiral Rachel Levine stands as a trailblazer in American public service, embodying the spirit of resilience, dedication, and progress. Her journey is not only remarkable for her professional achievements, but also for the barriers she has broken and the hope she has inspired in countless people across the nation. Levine's story is one of perseverance, courage, and a steadfast commitment to improving the health and well-being of all Americans. As a physician, Dr. Levine has spent decades caring for patients, advocating for evidence-based medicine, and mentoring the next generation of healthcare professionals. Her expertise as a public health expert has been recognized at the highest levels, and she has become a respected voice in the medical community, known for her thoughtful approach and compassionate leadership. In 2021, she made history as the first openly transgender person ever confirmed by the United States Senate for a federal post. This groundbreaking achievement was not just a personal milestone, but a powerful symbol of progress for the LGBTQ+ community, and for all those who believe in equality and representation in government. Throughout her career, Admiral Levine has faced immense challenges, including leading public health responses during the opioid crisis and the unprecedented COVID-19 pandemic. Her calm, steady presence and clear communication made her a trusted national figure, guiding communities through times of uncertainty and fear. She worked tirelessly to ensure that science and compassion remained at the forefront of public health policy. Her confirmation as Assistant Secretary for Health marked a historic milestone, not only for transgender representation in government, but for the broader movement toward diversity and inclusion in public service. Levine's appointment sent a message to people everywhere that leadership is defined by ability, integrity, and vision, not by gender identity. As a four-star admiral and head of the U.S. Public Health Service Commissioned Corps, she became the highest-ranking openly transgender official in U.S. uniformed services. In this role, she has overseen thousands of dedicated officers, leading efforts to protect and promote the nation's health on a grand scale. Admiral Levine has championed a wide range of science-based initiatives, from improving maternal health outcomes to expanding access to mental health care. She has worked to address health disparities, promote preventive care, and ensure that vulnerable populations receive the support they need. Her unwavering advocacy for health equity has helped shape policies that prioritize fairness and justice in healthcare. Levine believes that everyone, regardless of background or identity, deserves the opportunity to live a healthy life, and she has dedicated her career to making that vision a reality. Her work has always been about more than just policy. It's about saving lives, uplifting communities, and building a healthier, more inclusive nation for future generations. Through her leadership, she has inspired countless individuals to pursue careers in public service and to stand up for what is right. Admiral Levine's legacy is one of compassion, competence, and breaking new ground. She has paved the way for others to follow, showing that with courage and commitment, it is possible to create lasting change and leave a profound impact on the world. In the halls of the Department of Health and Human Services, the walls are lined with the faces of those who have shaped the nation's approach to public health. These corridors, often bustling with staff and visitors, are more than just passageways. They are living galleries that tell the story of leadership, progress, and the evolving values of our society. Official portraits serve as a lasting tribute to the individuals who have dedicated their lives to public service. Each frame captures not just a likeness, but a legacy, a visual reminder of the decisions, challenges, and triumphs that have shaped the course of American health policy. Among these portraits, Admiral Rachel Levine's stands out, not only for her achievements, but for what her presence represents. As the first openly transgender leader to be honored in this way, her portrait is a powerful symbol of inclusion, resilience, and hope for countless Americans who have long felt unseen. Her appointment and subsequent recognition marked a turning point, signaling that the doors of leadership are open to all, regardless of gender identity or background. For many, seeing her image among the nation's top health officials is a deeply personal affirmation that their stories, too, matter. For young people, especially those in the LGBTQ+ community, Levine's portrait is a beacon of possibility. It tells them that their dreams are valid, and that they, too, can aspire to serve at the highest levels of government. These portraits are more than tradition. They're a visual record of progress and values. Over the years, the faces in these frames have changed, reflecting the nation's ongoing journey toward greater representation and equity. The process of creating and unveiling an official portrait is steeped in ceremony and meaning. It's a moment when the contributions of a leader are formally recognized, and their story becomes part of the institution's collective memory. Levine's inclusion signaled official recognition of her historic contributions. Her portrait's unveiling was not just a personal milestone, but a public statement about the values the department upholds. It was a permanent acknowledgement of her role as both a leader and a pioneer, ensuring that her impact will be remembered by generations to come. The portrait stands as a reminder of the strength found in diversity and the importance of making space for every voice in the story of our nation. Its presence is a source of pride and a testament to a more equitable government, one that honors the past, embraces the present, and looks forward to a future where everyone can see themselves reflected in the halls of power. In late 2025, during a federal government shutdown, Admiral Levine's portrait was quietly altered. Her legal name was covered with her dead name, a deliberate act of disrespect. This change, made when only essential government functions were allowed, raised questions about the administration's priorities. The crude, temporary label sent a clear message of exclusion. The act followed the appointment of new HHS leadership, signaling a sharp policy shift. For many, it was a targeted attack on Levine's identity and a public humiliation. No historical precedent exists for such an official act of deadnaming. The incident turned a place of honor into a site of erasure. When the alteration became public, HHS defended the move as a matter of gold standard science. Spokesperson Andrew Nixon claimed the change reflected a commitment to biological reality, a stance rejected by major medical organizations. The department linked the act to a broader agenda of reversing LGBTQ+ health protections. Medical experts condemned the justification, noting that affirming transgender identities is essential to health and well-being. HHS's response positioned the department against established medical consensus. The move was widely seen as a calculated political act, sending a chilling message to transgender people. It made clear that the new leadership would not respect or protect transgender identities. Admiral Levine's allies responded with swift outrage. Her former deputy, Adrian Schenker, called the act petty and bigoted, highlighting its unprecedented nature. Schenker contrasted the focus on Levine's portrait with the urgent public health crises facing the nation. He urged HHS to prioritize real health threats over political stunts. Inside HHS, staff described the act as demoralizing and a clear erasure of transgender individuals. The backlash framed the incident as a violation of human dignity, not just a policy dispute. Levine's supporters vowed to challenge this act of discrimination. The defacement of Dr. Rachel Levine's portrait is not an isolated act of vandalism, but rather a visible symptom of a much broader and deeply rooted campaign by the Trump administration to roll back hard-won rights for transgender Americans. This act, which took place in a government building, is emblematic of the hostile environment that has been fostered at the highest levels of power, where policies and rhetoric have increasingly targeted transgender individuals and their allies. Over the past several years, a series of policy changes have specifically targeted transgender service members, reversing previous efforts to create a more inclusive military. At the Pentagon and the State Department, protections and opportunities that once allowed transgender people to serve openly and with dignity have been systematically dismantled. These reversals have sent a chilling message to those who once felt hopeful about progress, signaling that their service and contributions are no longer valued by their own government. For transgender Americans, these changes are not just political maneuvers. They have real, tangible consequences. Barriers to healthcare, employment, and public safety have grown, making daily life more uncertain and often more dangerous. The sense of equality and security that many had begun to feel is now being undermined, replaced by anxiety and fear about what rights might be taken away next. The groundwork for this hostile climate was laid during the 2024 presidential campaign, which was marked by a surge in anti-transgender rhetoric and divisive imagery. Political ads and speeches frequently singled out transgender individuals, with Dr. Levine often becoming a focal point for attacks. This strategy was not accidental. It was a calculated effort to energize a political base by scapegoating a vulnerable minority. The incident involving Levine's portrait is a direct manifestation of this broader political strategy. It is a physical act that reflects the intangible harm caused by policies and rhetoric designed to marginalize and erase transgender people from public life. By targeting Dr. Levine, the administration sends a clear and chilling message that transgender identities are not only unwelcome, but actively devalued at the highest levels of government. This message reverberates far beyond the walls of government buildings, affecting the lives and well-being of transgender people across the country. The defacement of Levine's portrait stands as a stark and painful symbol of the precarious position transgender people occupy in today's America, a reminder that the fight for dignity, respect, and equality is far from over, and that the political climate remains fraught with challenges and uncertainty. Replacing Levine's chosen name with her dead name is a profound act of erasure. For transgender people, a name is central to identity and dignity. When a government agency deadnames someone, it signals institutional rejection of transgender identities. This act has a chilling effect, fueling discrimination and undermining trust in public health institutions. Major medical organizations agree. Affirming gender identity is essential to competent care. HHS's action contradicts its mission and damages its credibility. This controversy is about more than a name. It's about the right to self-determination and respect. The fight for equality and dignity remains urgent and unfinished. Admiral Levine responded to the attack with grace and dignity. She simply reaffirmed her honor in serving the American people, refusing to be drawn into a war of words. Her silence shifted the focus back to her achievements and public service. By not engaging with the pettiness, she demonstrated strength and composure. Levine's response was a powerful example for others facing discrimination. Her legacy is defined by her service, not by the actions of her detractors. In the face of disrespect, she chose dignity over conflict. The controversy over Levine's portrait is a reminder of the divisions in our society, but also an opportunity to reaffirm our values. Every person deserves recognition and respect, especially from government institutions. Leaders must focus on real public health challenges, not divisive cultural battles. Acts of exclusion are a disservice to the nation's well-being. We must recommit to inclusion, empathy, and accountability. The legacy of leaders like Levine should be measured by their service, not the prejudice they face. Let's ensure our government reflects the best of who we are. A nation that values every person,